is a WLKY special presentation.
Wasn't there for my daughter, homeless, addict.
State of Addiction.
It is happening to the middle class, loving families who are active in their community, playing sports, kids holding down jobs.
A far-reaching epidemic.
We know that we cannot arrest our way out of the problem. And so we know that treatment is a very important aspect of that.
Welcome to State of Addiction. I'm Rick Van Hoos.
And I'm Jennifer Bayless. We see the images every day. Car crashes, arrests, and in some cases, death, all attributed to the growing drug crisis.
The heroin and opioid epidemic is having a devastating impact on families across the country. The question many are asking now is, how do we fight it?
Morgan Lintis talked to local families struggling with addiction.
I started doing drugs when I was 17. I was a parent when I was 18, and now I'm raising a grandson that has two parents that are heroin addicts.
Lloyd Brown is fighting for his family. The Shelby County man joins a long list of Kentucky families scared for the future of their children and grandchildren.
My grandson has no parents that have done, in the last 5 years, so he has a 6 times greater chance of being a drug addict because of that fact alone.
An estimated 20.5 million Americans suffer from addiction, and it's forcing many children to live with relatives or go into the foster care system. The most recent data shows in 2015 an estimated 428,000 children were in foster care in the U.S. That number has increased each year since 2011. Across the river in Clark County, another mother is battling addiction in her own family. Melinda McKenzie has 3 children who have been addicted to drugs.
He was 24, and one day he called me up and said, I have a problem.
Melinda is talking about her son Ian, who is now 30 years old.
He never left home without Bert and Ernie.
Ian was addicted to heroin. He wasn't her first child to use the drug, and he wouldn't be the last.
I was shocked. I couldn't believe it. And he told me he had been playing around with drugs since he was 16, and I didn't see it.
That's the conversation she had with her youngest son, Gordy. Her daughter, Danielle, was the first to battle addiction.
And then every mom and daughter would leave with their own little picture.
Melinda keeps these pictures on the wall of her Jeffersonville home to remind her of happier times.
This addiction affects the entire family. It doesn't just mom and dad and brothers and sisters. Everybody in the family struggles because of this, and so nobody talks about it. The shame is too great.
But talking about it is exactly what Melinda is doing now. Her mission to show others that addiction is everywhere and can affect anyone.
It is happening to the middle class, loving families who are active in their community, playing sports, kids holding down jobs.
And Melinda plans to continue sharing her story to give others hope.
People ask me, why do I do this? Because I've been that mom on the other side. And if there's a mom right now, look at me. And she says, I can't do it. You can't. You can do it.
You are not alone. That's the message a Louisville doctor is sending to pregnant women who are addicted to drugs or alcohol. And now there's a new program aimed at saving both mother and baby from addiction.
He was a survivor. He was a little survivor.
Born 6 pounds and 3 ounces, Matthew Brian Butler made his debut February 7th.
It was terrifying. Just because I knew, what had been going on, and it just scared me, what I'd been, putting the baby through, and didn't even realize it.
Matthew's mother, Marcy Cruz, says his birth was exciting, but she was worried because she used heroin during her pregnancy.
The entire pregnancy, I was worried about it, actually.
Cruz and Matthew's father decided to get clean together. She entered the New Vision program at 5 months pregnant.
We have a licensed social worker that works with us. We have New Vision's nursing staff that reaches out to the community and makes certain that patients understand that they can come to a place where we've got a group of professionals who understand the disease, who want to provide care. They don't have to worry about being persecuted.
New Vision started at Norton Hospital 2 years ago. Dr. Jonathan Weeks and service coordinator Paige Ross immediately realized just how much the service is needed.
We really had no idea that the need was this great. And we see on average 15 to 25 patients a month for the inpatient hospitalization piece. we could see that, doubling in the very near future.
The most used substances among patients are heroin, Suboxone, and pain pills in that order. All are opioids. Most New Vision patients are part of a medication-assisted treatment plan that includes Subutex or methadone. Patients are stabilized and sometimes weaned off the medication because it can be deadly if the mother stops using cold turkey without medical help. Marcy was given Subutex, and Matthew only showed mild symptoms of withdrawal or neonatal abstinence syndrome. He was in the hospital for 6 days and is now healthy.
I feel like because, I stayed in these programs that I'm in and, stuck with my recovery. And, just went to people whenever I needed support. Because I did that, it made it a lot easier for him.
In 2015, more than 1,200 Kentucky babies were born with opioid withdrawal symptoms, and that number continues to increase. Christina Moore shows us how doctors and nurses in Louisville are working to help newborn babies.
The number of newborns treated for withdrawal symptoms or neonatal abstinence syndrome has increased dramatically in Kentucky.
We've gone from about 46 babies to 1,234 babies in 2015.
Nationally, the number of babies born in withdrawal has tripled over the past 15 years. That's according to the Centers for Disease Control. It's a dangerous trend. More mothers are using opioids like heroin during pregnancy. Christy has spent half of her 33 years addicted to drugs.
Once you get to a certain level, you can't get no higher, and you just keep wanting to get higher and higher and higher. So then from there, I went, recently in the last 7 months, I went to heroin. And that's when I knew it was a really big problem.
A month into her heroin use, Christy found out she was pregnant.
Yeah, that's a big concern. That's why I'm so ready for May to get here, so I'll know.
The National Institute on Drug Abuse says every 25 minutes in this country, a baby is born suffering from opioid withdrawal.
As soon as the umbilical cord is clamped, all the opiates the baby has been exposed to throughout the pregnancy are gone.
At any given time, Norton Hospital treats 10 to 15 babies for neonatal abstinence syndrome, or NAS. This little girl is just 18 days old. She's going through withdrawal similar to what an adult addict would face. Tremors, high-pitched crying, restlessness, sweating, and eating issues.
They have issues and problems both with their central nervous system, with their GI system, and with their autonomic nervous system.
Infants with NAS stay in rooms with low lighting, quiet sounds, and they're wrapped and held in specific ways to soothe them. And doctors and nurses treat opioid withdrawals with opiates like morphine in small doses very carefully.
We want them on medication for as short of a period of time as we possibly can make it happen, but we also don't want them to suffer as they're going through this whole process as well.
The process can take 2 to 6 weeks, and while the goal is for babies to leave with their mother, 30% of these infants will go home with a different family member or non-related foster parent while mom gets help. Doctors say more research needs to be done about long-term effects of NAS, but there are a few things they've learned so far.
When they hit school age, there's an increased risk for depression, anxiety, ADHD, and if you ask the teachers at school, they are seeing this on a regular basis.
Coming up next, fighting the crisis together.
If we all work together on this, we can probably, hopefully get a solution done.
Local police agencies stepping up efforts to crack down on dealers while getting addicts the help they need.